Hello and welcome back to Wellness Unplugged, your space for honest, open conversations about well-being and healing. I'm Lesley, a counsellor and pain consultant here to walk alongside you as we explore the deeply human experience of pain and how it evolves across the different stages of life. Today's episode takes a closer look at something we rarely discuss in full. That is, the way pain expresses itself in childhood, adulthood, and later life. Pain, after all, isn't a one-size-fits-all experience. The way it is felt, processed, and responded to often shifts with age, psychological developments, and life context. Understanding these shifts not only makes us better caregivers and professionals, it also deepens our self-awareness and compassion. So take a moment to settle in and let's dive into this layered, important conversation. To start, we need to understand what pain is. We looked at this in depth last week, so here is a quick recap. Pain is your body's way of getting your attention. It's a signal, like an internal alarm, telling you that something isn't right, whether it's a physical injury, an illness, or even an emotional stress. And while we often think of pain as something purely physical, it's actually shaped by so many things: our emotions, our memories, our stress levels, and even how supported we feel. That's why two people can have the exact same injury but experience pain very differently. So how do we actually feel pain? Well, it starts with those special nerve endings in the bodies called nociceptors. These little sensors are always on the lookout for danger, like heat, pressure, or injury. When something harmful happens, they send a message through your nerves, up your spinal cord, and into your brain. But here's the interesting part. Pain doesn't really happen until your brain decides it does. The brain takes in all the information and decides how serious it is, whether it needs your attention, and how much it should hurt. And what influences your brain's decision? Well, your mood, past experiences, stress levels, even how safe or supported you feel in the moment. In other words, pain is never just physical. It's also emotional, psychological, and deeply personal. Right, so much for the recap. Let's kick off today's discussion with pain in childhood and how little bodies and big feelings can often collide. Pain in childhood is complex. It's not just because of physiology, but because children are still learning how to interpret and communicate what they feel. Their nervous systems are still forming, and the emotional scaffolding required to process pain is still in its early development. Children's sensory pathways are more reactive, and their brains haven't formed yet the mature network required to regulate emotional distress. This often means pain feels more immediate, more overwhelming, and more confusing. Common childhood pains such as injuries, ear infections, headaches, growing pains, and in some cases, conditions like juvenile arthritis or unexplained chronic pain. Even brief episodes of pain can be deeply unsettling for a child still learning that pain doesn't equal danger. Children may cry, act out, become withdrawn, or regress to earlier behaviors as an emotional response to pain. Importantly, they may not have the vocabulary to express what's hurting, which is why their pain is often misunderstood or dismissed. Persistent or poorly managed pain in childhood can have long-term effects, including increased pain sensitivity, anxiety, and avoidance behaviors later in life. In essence, how we respond to a child's pain becomes part of their psychological blueprint. So how do we offer support to children in pain? We offer age-appropriate explanations and empower them with understanding. We use non-verbal comfort, gentle touch, soothing tone, or simply just sitting holding them. We incorporate expressive tools like drawing or storytelling. We encourage attentive caregiving. We watch for shifts in sleep, eating, or mood. And finally, we collaborate with pediatricians and the mental health professionals to manage both physical and emotional dimensions of pain. What about pain in adulthood? that balancing the burdens, bodies, and beliefs. By adulthood, pain becomes more layered. It's not just physical, but psychosocial. The body is aging, responsibilities are mounting, and emotional resilience is often under pressure. This is where the intersection of biology and psychology becomes particularly sharp. Types of pain that we can experience in adulthood: musculoskeletal pain, tension headaches, autoimmune disorders, migraines, post-surgical pain, or pain from chronic conditions like fibromyalgia or diabetes. Emotional pain such as grief, burnout, or trauma often coexists and complicates diagnoses and treatment of pain. The psychological factors that can affect pain include stress, anxiety, depression, and trauma, and all of these directly influence how pain is actually experienced. For example, unprocessed grief can manifest in physical ways, while chronic pain can exacerbate emotional distress. This causes the inevitable feedback loop. Many adults feel obliged to push through the pain, whether it's because of career pressure, caregiving duties, or cultural norms around strength and productivity. Pain is often minimized, internalized, or even moralized, and is often viewed as a weakness. Unmanaged pain can impact intimacy, career progression, parenting, and emotional health. Often people wait far too long before seeking help, by which time the pain has embedded itself not only in the body, but in identity and in relationships. How do we support adults with pain? Well, we pursue integrated care, medical, psychological, and lifestyle. We educate around the body-mind connection. We gently introduce movement and pacing strategies. We encourage therapeutic work to explore trauma or emotional stress, and then we validate pain, even when it's invisible. In fact, especially then. Let's turn our attention now to pain in older adults, its complexity, its dignity, and the wisdom of the body. Pain becomes more prevalent in later life, yet paradoxically, it's often underreported and undertreated. Older adults may view pain as normal. They may be reluctant to burden others. Add in cognitive decline or communication issues, and the picture becomes even more nuanced. Common pain conditions that exist in later life: osteoarthritis, neuropathic pain, degenerative joint disease, post-stroke pain, or complications from chronic illnesses. Many elders often experience pain following bereavement or through loss of purpose and connection. Add to this the cognitive challenges some elderlies face: dementia, Alzheimer's, or stroke-related impairments that can make self-reporting difficult. It's essential that caregivers and professionals are trained to interpret behavioral cues like agitation, restlessness, or facial expressions as potential pain signals. Loneliness, fear, helplessness, and unresolved trauma can often intensify the perception of pain. A lack of emotional support often leads to increased suffering, even when the pain itself is medically managed. Older bodies process medications very differently and increase the risk of side effects or interactions. This often requires more nuanced or conversational approaches to pharmacological pain relief. How do we support older adults in pain? Regular assessments include nonverbal and behavioral indicators. We combine physical treatment with emotional and spiritual care. We foster connections. Loneliness tends to amplify pain. We provide education that pain is treatable, not inevitable. And most importantly, we honor their dignity by listening deeply and responding meaningfully. No matter your age, pain is never just physical. The nervous system doesn't distinguish between a broken bone and a broken heart. The experiences of pain is filtered through beliefs, memories, stress levels, and history. For someone with trauma, the brain may stay in a hypervigilant state, interpreting normal sensations as threats. For someone with depression, pain might linger longer or feel heavier. Social isolation, shame, and invalidation intensifies the impact of pain, whereas empathy, presence, and care can literally reduce it. So, what are the keys to understanding pain? Well, firstly, honor its unique presentation in each life stage. Treat the whole person, not just the symptom. Listen, validate, and believe. And foster environments that are safe, informed, and supportive. Thank you for joining me on Wellness Unplugged today. Pain is part of the human experience, but when we understand it, we don't have to be ruled by it. Whether it's a child with a skinned knee, a stressed adult navigating chronic illness, or an elder living with arthritis and grief, each pain story matters. If you or someone you love is struggling with pain, emotional or physical, please reach out. I'd love to walk that path with you. You can contact me via email at info@lesleyharvey.co.za. And as we prepare to open Your Wellness Matters in Pennington, we're working hard to create a space where healing is holistic, kind, and rooted in science and compassion. We'll be there to walk the pain journey with you, gently yet grounded in care. And as a final thought, pain is inevitable, suffering is optional, and understanding is the first step to healing. This has been adapted from Okuri Mukurami. Until next time, unplug, recharge, and remember, your wellness matters more than you think.
The radio station you can't live without. This is your radio.
This is South Coast Radio.